Medication abortions now outnumbering surgical methods of the procedure, but a federal judge says one abortion pill in particular was not properly studied by the FDA when the agency approved it roughly 23 years ago. Now that judge issuing a reversal on the FDA's approval of mifepristone. The drug is used along with another pill called misoprostol to end a pregnancy. The Justice Department has appealed the ruling for now as some states begin ordering more abortion pills for their residents.
It is quite extraordinary in terms of second-guessing the scientific conclusions of the FDA. As far as this judge is concerned, there's no procedure or medication for abortion that would be acceptable.
Meanwhile, at the New York State Capitol, state officials taking action to protect abortion rights, with the state buying and stockpiling hundreds of thousands of doses of the common abortion drug.
This isn't just an attack on abortion. It's an attack on democracy. Courts have never before revoked a science-backed decision made by the FDA. And if this decision stands, it could have unprecedented consequences that reach far beyond abortion, threatening the FDA's critical role in our country's public health system.
Governor Hochul also proposing several actions to protect access to abortion care as part of the executive budget. In her proposal, $25 million would go to abortion providers, Medicaid reimbursement rates would increase, and abortion access would expand on SUNY and CUNY campuses. Anti-abortion groups across the state responding to Hochul's announcement yesterday as well. Feminists Choosing Life of New York releasing this statement, which reads in part, quote, "Women do not need more abortion. We need more life-affirming resources, including affordable child care, better paid parental leave, prenatal child support, and expanded child tax credit policies," end quote.